spinal, that is back and neck, and joint pains. So, I usually talk about spinal and joint pains, and most of my videos are on these topics. And today, let's talk about three such myths that you keep hearing about neck or back pain or joint pains. Now, you might have heard people say things like, hey, this is a normal part of your aging process, or this is going to happen with age, you got to live with it, etc., etc. But then on the other side, we also see people who are very fit, very flexible, doing yogas, doing inversion exercises. I mean, they're doing a lot of stuff even as they age. So, why and how do these people manage it? And if they can do it, why can't you do it, right? So, let's talk about three such myths about spinal and joint pain. But before we jump into the topic, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids to manage their spinal and their joint pains. Now, I do this by giving you simple exercises, easy strategies, lifestyle changes that are easy to implement, tips, tricks, and hacks. Now, let's talk about the very first myth about spinal and joint pain. And that is, as I said, this is a part of the aging process. All right, so your body is like a machine. There is wear and tear in the body as we use it. However, this is called degeneration. However, people accept that degeneration is going to happen. And yes, if degeneration has happened in your spine or your joint, uh, you don't have to worry about that, because yes, you can, it has happened, you cannot reverse it. However, what you can do is you can slow down this degeneration. And if you are one of those lucky few who've not yet started with this process, or who have a minimal amount of degeneration in their spine. I guess with our lifestyle nowadays, everybody has a minimal amount of degeneration in their spine or joints. If you have this minimal amount of degeneration, it is possible for you to delay the process or slow it down substantially. Now, I'll give you my example. I have got bad menisci in my knee for over 2 decades. So basically, I've got knee joint pain. So with my knee pain, I was not able to do even quarter squats. And that is a bit of a problem, right? When you have younger kids and when your job involves standing all the time, or doing a lot of exercises, showing a lot of exercises to your patients, etc. So I used to find it a big hindrance, and my knees would get locked at some or the other point. And if anything that I did, I could not get it down to the level that I have got it now. So what I did was I joined a jumpstart program that one of my friends, Martha, she's running, and that has helped me bring down the inflammation in my knee substantially. And I feel that now I can actually do a deep seated squat, and I can hold the squat. The last time was about 12 minutes that I could hold the squat. So if I can do that, I guess anybody can, right? My knees were really, really bad. So I have MRIs if you want to have a look. So the second thing that everybody will tell you is learn to live with the pain. Now, there are two sides of this. Yes, learn to live with your pain. Don't cry about it all the time. People don't want to hear that. And you have to learn to cope up with your pain and to work around your pain. But that does not mean that you accept that this is going to be my life from now onwards and I will never be pain free. So, there are solutions. Um, a friend of mine who's doing the same program with me, the Jumpstart, it's just 11-day program. So I mean, we can do anything for 11 days, right? So she had really swollen knuckles, and she's a rider, so she rides horses. And she's much older to me. However, she has managed to get rid of those swelling and pain in her knuckles, and her wedding ring actually fits after all these years of knuckle pain and hand pain. So she did not accept that she has to live with the pain, and she was able to get better. She was able to get that inflammation down in her knuckles and her hands. So basically, she could manage her joint pain, hand pain better, right? So, another thing that the third myth that I wanted to talk about is, once you have a chronic condition, you think that medicines are for life. And yes, they are for life, but then if you manage to say you have diabetes, right? Your A1C numbers are like really high. So that is the parameter that decides how what's the status of your diabetes. So if suppose your A1C numbers are really high, you basically, the doctor will tell you that you have to take this medicine all your life. Yes, that's right, but what if you get those A1C numbers down? What if you're able to manage the inflammation, the disease process, and you're able to bring those blood works, those lab results, those numbers down? And of course, your doctor is going to reduce the medication. No doctor wants to put you on medication forever, right? So it is possible that you can. Obviously, with the help of your doctor, you don't do it yourself, but you can go back to your doctor and you can get off or reduce those medications. So I cannot take names here because I've not taken permission, but if you want, I can actually send you these testimonials. I can get you in touch with these people, so I'm not just talking off the top of my head. Another lady who's doing the jumpstart had rheumatoid arthritis for 25 years, and she has I mean, she felt like her elbow and her joints were on fire. Her inflammation was so bad. So, inflammation basically means pain, swelling, redness, loss of function. All these put together is actually called inflammation. So, she felt the heat or the warmth and the pain in her joints, especially her elbow was so bad she could hardly sleep. After the jumpstart, she has been able to manage the pain so well that she's sleeping a solid 8 hours at night. So, what I'm trying to say here is these are the usual myths that we have accepted as a part of our lives when it comes to your neck, back, or your joint pain. However, you don't have to live with the pain. You don't have to accept this as an aging process. You don't have to be on medications for life. There is a solution. And really, I mean, it's just 11 days, right? Even when you make a New Year resolution, you stick to it the whole of January. That's 30 days. So if you can stick to this for 11 days, shoot me a message if you're interested in more details. You want to know more about the 11 days. What exactly are you doing? You're not calorie counting, you are not cutting out your desserts, you're not starving yourself, you are just eating a healthy diet, you're exercising within the pain free range. So if you're one of those who are in a wheelchair, yes, you have, I will tell you the exercises that you can do sitting in your wheelchair. If you are one of those who are doing a boot camp or heavy exercises in the gym, yes, you can do that as well. So depending on where you are at, the exercises can be tailored for you. There is quite a few components in this 11 days, but your diet, exercise, and there is a supplement that is included. These are the three main things. The supplement is all natural. If you know me for more than 2 minutes, you would know that I go for all natural stuff and I lead a very low toxin lifestyle. So this is a very natural, it's called a supplement. It's actually a juice. It's an anti-inflammatory juice. If you want you want the details or you want a copy of these testimonials, shoot me a message and I will leave a link in the description of this video that will give you more details. There is a video by Martha, the lady who's running it, so you will get more details there. Alrighty, and oh yeah, if you're watching me on Instagram, the link is in my bio. And if you have any questions for me, any comments on this video, do drop them below and I will address them for you. Alrighty, I'll see you guys next time. Bye for now.